Hi, welcome to Ask Dr. Tan. So this is a new series where we collect questions that we get from all our social media platforms from the community, and then we try our best to answer them. So every week we'll be selecting three commonest questions, and then we'll try to provide as good an answer as we can. So this week we are actually talking about chlamydia. So let's look at the first question. It asks, where does chlamydia affect? I think what the asker is trying to ask is, where does chlamydia infect? Now, most people would imagine that chlamydia can only infect the urogenital system, right? Because it is one of the commonest, in fact, it's the commonest sexually transmitted infection in Singapore. But little do people know they can infect other places such as the throat or even the eyes. So the lesson learned here is, if you're going for chlamydia screening, make sure to tell your doctor about all your sexual practices so that the doctor then knows which area to screen. Also, discuss with the doctor if you have any symptoms of infection, right? So the question is, and this is actually quite a good segue, the next question is, are there always symptoms? Now, unfortunately not. In fact, some studies have shown up to 7 out of 10 people, both men and women, who get infected with chlamydia actually do not show any symptoms. So even if you don't have any symptoms, it's actually a very good idea to get checked for chlamydia, because if you don't, there could be complications down the road. So the usual places that we screen, depending of course on sexual practices, would be the urethra, that's the place where the urine comes out, or the vagina for women, the rectum, the throat, and if there's symptoms, even the eyes, right? So the third and last question is, what if I do not treat it? Well, unfortunately, if you have chlamydia and you don't treat it, then you can pass it on to your partner. In fact, if you don't have symptoms, then you unknowingly passing on to your partner. Untreated chlamydia also can cause fertility problems, more common in women, but in men also, because the infection can then spread to the testes, through to the other tubes connecting the testes, and then can cause a lot of inflammation, pain, scarring, and eventually infertility. So I think that does it for our 3 questions today on chlamydia. We'll catch you next week for the next Ask Dr. Tan segment.